Hi guys, welcome to my YouTube channel. My name is Blessing. If this is your first time coming on this channel, I'm your nursing student Bestie and I'm glad to have you here. I put videos out every week. If you're not subscribed to this channel, kindly subscribe so you don't miss any of my videos. On today's video, I'm going to be teaching you how I remember hypertension meds. Now, I need you to write this down somewhere, okay? We're starting class. First is the ACE inhibitors. Second is the ARBS, like ARBS. Third is the calcium channel blockers. Fourth is the beta blockers. Five is the diuretics. So I group them down this way because that is what makes me remember. Nobody has the time to start remembering the names one by one. I only remember like the last syllable and that's it, honestly. So let's talk about ACE inhibitors. You want to remember ACE inhibitors with PRIL. Something my lecturer taught me when they taught us this is think about the cards. You know when you play cards, like the ACE cards? It gives you like this thrill. You feel good playing the cards. So think ACE, think PRIL. That is where you have lisinopril, captopril, captopril. It lowers the pressure. I have this things make me remember like the side effects for ACE inhibitors. The A stands for angioedema. The C stands for dry cough. The E stands for elevated liver enzymes, elevated potassium too. If your patient starts coughing or you see that they have angioedema, it's wraps. You gotta find a different med, okay? Now let's talk about the ARBS. ARBS. When you see an ARB, you need to think sartan. I don't know how you need to think about meds ending in sartan. So let's think about it this way. When you see ARBS, ARBS is spelled AR, right? You see sartan. What do you have in sartan? SAR. Are you feeling me there? Now, this is something I came up with for myself, okay? ARBS, sartan. It also reduces the blood pressure, but in this one, you do not have any cough. So if your patient is probably coughing, has like consistent dry cough with the ACE inhibitors, you might want to switch to the ARBS, okay? But then this one also increases potassium levels. Now for calcium channel blockers. This one, just remember it as calcium. It calms the heart and the vessels. So these are the meds ending in PINE. I don't know how you would remember this one. Calcium. Maybe remember it as calcium, like something strong. Then remember like pine trees, right? Like those trees are strong. So calcium, PINE. So that is where you see meds like nifedipine, amlodipine. Just know it relaxes the heart. It lowers like the heart rate. Avoid grape juice with calcium channel blockers. It's it's a must. And then monitor for edema. And then we move on to our beta blockers. Beta blockers. So you know how when you block someone, right? It's sometimes it's a laughable moment. So think like LOL, lol, I blocked him. So beta blockers, usually it's olol, OLOL, but you could think about it as LOL. So this is where you have meds like metoprolol, atenolol. Now the thing with this one is it could mask hypoglycemic effects in a patient with diabetes. And you certainly do not want to give this med if the heart rate is lower than 60. We know the normal heart rate is 60 to 100, so you don't want to cause hypotension, so don't give if it is lower than 60. And then lastly, we have our diuretics. Now, we have three types of diuretics. We have the loop diuretics, we have the hydrochlorothiazide, and we have the potassium sparing diuretics, right? For the loop diuretics, just think IDE, like IDE. Like I drain everything with the IDE, right? Because this patient is just gonna be peeing and peeing. You need to check Check hydration. You don't want that patient dehydrated, okay? And for the thiazide diuretics, it does the same work as the loop diuretics. Just know it lowers the blood pressure because you're peeing out all that fluid. Of course, the blood pressure is gonna come down. And lastly, we have our potassium sparing diuretics. Just like the name implies, potassium sparing. You're gonna start peeing out all the other electrolytes, but guess what? You're not gonna pee out potassium. This could cause hyperkalemia if you're not careful. And an example of this potassium sparing diuretic is spironolactone. And one thing that makes me remember, SP for sparing, potassium sparing, so spironolactone. Now, potassium sparing diuretics like the spironolactone is the only one that spares potassium. Loop diuretics, thiazide, could tank your potassium. Like, you could have hypokalemia with those ones. So that is that. You don't need to remember every single medication for their names. Just remember their endings, the side effects, what to avoid, what they do, and you should be fine. I've been fine so far. All right, thanks for watching today's video. Kindly subscribe, drop a comment, give me a like to encourage me to put out more videos. Share this video with your friends and family if you found it helpful. And I'll see you in my next video. Thanks for watching today's video. Bye.